just ask Megan, Stephanie, and Alex to each introduce themselves and kind of say a little bit about who they are and why they're sitting at this part of the room. So why don't we just start on my end of the table and work our way down. I guess if we push a little bit of light on, you can talk.
Hi, I'm Megan Rochuk, 25 years old, HLHS, TGA, BSc. I'm currently working on my master's in child and adolescent development, and I'm a teacher.
Hi, my name is Alex. I'm HLHS as well, I'm 19 years old. I'm working on my psychology degree, and I'm basically self-employed. I clean units, that's it. Simple stuff.
Hello, my name is Stephanie Romer, and I'm going to be 30 in 4 weeks. I have HLHS, transposition of the great vessels, ASD, VSD, and severe mitral stenosis. I am one of the first Fontans ever. In 1988 is when I had my Fontan procedure. I was a nanny on and off for about 11 years, and for the past 7 years I've been traveling and researching CHD and getting to know my own people. I'm a writer and advocate for CHD.
So this is quite a panel we have up here. I think it's pretty powerful to see all these people who overcome so much. And I know that Marshall is going to have to catch a plane shortly, so before he does, I want to get his thoughts on a few things. And one thing I would ask initially is from a non-medical point of view, it's from an overall kind of global life point of view. So you're sitting here and you can think about all these long nights in the 1970s and 1980s when you're driving into the hospital at 1,000,000 miles an hour for some emergency, and there's a lot of detractors, and you're fighting a lot of battles just to be able to do what you're doing. And Dr. Norwood's fighting the battles and you're fighting the battles. Is this where you thought it would end up? And what are you sitting up here on the panel with all these people, what do you think?
Well, I didn't have any idea how it would end up, but I think you could tell from the difficulty that I had controlling my emotions talking after Megan Roswick that I feel so privileged to have been a participant in this process and to have shared the experience with so many families, and I hear from them, and it makes it all tremendously worthwhile. I get to see people like the Roswicks. I ran into Chase Carlisle, 22-year-old musician, composer, and producer whom I hadn't seen in 19 years, but kept in touch with his mother and grandmother by email. And I think for people like Jeff and myself, and Rick Martinez and Jim Q, we couldn't be luckier. You couldn't find a more rewarding profession than to collaborate with these families in the care of their children.
Well, I think it is special to have Marshall here. We strive in our careers to have careers the way he has had and make the contributions that he's had, and to have us put a little perspective. Before we open it up to general questions, sitting way back there is Jim Q. And I wanted to ask Jim to comment on a couple of things based on, so I got here in 1998, and Jim at that point been here for close to 10 years, and we were kind of trying to figure out how to treat patients with hypoplastic left heart syndrome. And initially when I got here, really there was no treatment. We were starting to do heart transplants, and eventually figuring out how to do this Norwood operation here, and that was mainly Jim leading that, driving that bus, and figuring out how are we going to do that operation here. And it wasn't such a good operation to do in the 1990s here, and the results weren't so good. And now in 2015 and 2014, they're as good as anywhere in the world and better than most, and that's mostly because of Jim's leadership. And I wanted to ask Jim kind of the same question, and to comment on, we've got this panel here, and there was a lot of late nights you and I spent in that ICU, and there was a lot of people that were telling us, well, what are we doing? And you kind of ignored them all and plowed ahead. And as to where we are now. So what do you think about when you see something like this?
Well, first of all, I'm very privileged, I think, every day to be able to do what we do. And I think the real pioneers and the people like Marshall say, the determined families and the people who persevered through all this really should get the most credit. I think what we do as physicians, we work really hard every day to try to do the very best we can and come up with moving the needle a little bit forward, a little bit further every time. And a little bit later, I'll talk about this, where we'll see incremental progress being made, but it's challenges that kind of beget more challenges, and in the early days, we elected to do transplantations of primary therapy in the mid-1990s, just because the results with state reconstruction were just very marginal, but it was very early in the whole process, and just in our careers, and Marshall's a few years older in this than me, and be a little bit further along than Jeff, we've seen tremendous progress. And I think that trajectory, if you can imagine it, we know we've got a lot more work to do, but I think that trajectory is encouraging. And I can tell you, I was born in 1957. If I had a VSD, I'd probably not be here talking. Now we have people with VSDs who have normal lives as a routine thing. So, in a relatively short time, there's a dynamic change that we see in this field. And I can just tell you, we're all in to try to make it as best we can, and that's what we're all going to do together. And so, I don't know if I answered the question, but that's what I thought.
You're awesome. So now what I want to do is focus on the part of our panel up here that actually has scars on their chests and has gone through all of this. And we have some questions that we wanted to ask Megan and Stephanie and Alex. And we'll start out and we just go right down the line here. This is a question both in childhood and now as well. So when you were a young child and a teenager, how did you explain to your classmates, your peers, why you had a star on your chest, what you had, and why you were different from other people? I think that's a question that people in this room with young children who are trying to become like you are very, very interested in. So as you're going through school and somebody asks you, can you do this, can you not do this, why do you have that scar, what did you tell them?
I participated in gym. My gym teacher talked with my mom and just said, let her stop when she needs to stop. So I participated in everything I could. Telling people, it was more asked of why my voice is the way it is, because I have the vocal cord paralysis. I never really showed my scar. It was more of my best friends are the only ones that really do. As I grew older, I just told people I was born with half a heart. And then they asked their questions and I explained to them everything that I knew about it at the time.
Well, that's basically the same thing she does. My teachers knew my limitations in school through my parents and psychologists. And any kid that would ask, what's up with the scar, I would just be like, yeah, I got a half heart. It's pretty cool.
Yeah.
No one knew until maybe a few years ago on Facebook, and then people were writing to me and freaking out. I did everything, and I guess I can only remember 2 people in my childhood that knew I had a scar, but it was, they took it to the grave with them. It was, no one knew. No one knew. Yeah, no one knew. So I pretended as best as I could. I lied when I needed to, and I did everything that other kids did in front of them. And as far as playing softball and being out of breath and not being able to practice during softball, I got teased a lot, but the way I played it off, I didn't let people think anything. I played stupid a lot. I did little different ways of just not letting people know that anything was wrong with me physically. And so, yeah.
I got a little creative. I would say it was a bear attack or a shark attack, or no, it got old really quick. And so I would just basically do that sort of thing and kind of make up things. And I'd be like, no, I have art, and kind of move on from there. I started gymnastics when I was 3, and so I was in a leotard. You could see my scar all the time. And I actually remember Mom telling me a story, I forgot which age it was, but I guess a kid asked me if I was a witch. Don't really know where that came from, but I definitely got teased. It was just a right there, right in your face, easy target. Everyone gets teased. Scar was just an easy target. So with help of my parents, I kind of brushed off with humor. It didn't really affect me that much. I mean, in all honesty, I probably fought my parents the most to try to wear a bikini. I remember I couldn't wear a bikini until I was like 18. Modesty. So for me, I kind of brushed a lot of it off on humor, and people saw it, and so I just said I had half a heart.
I think same for people. Another question. What do you remember, if anything, about your Norwood Glen Fontaine kind of surgeries when you were a little kid? Now you guys are like 2 decades away from that. What do you remember about it?
I don't remember anything. The only thing I remember is what my parents have told me, and that was when anybody came in with a white jacket, I would tell them to get out. So, anything of surgery-wise, I don't remember anything.
I don't remember anything either, but there's one memory I had was waking up from a cath. I think it was like my very first cath, just looking outside the view while it's snow in the area. Because I grew up in Cincinnati, Ohio. It's cold all the time, you know. So that's my very first memory. It was nice.
I too do not remember anything. The only memory I have is I was in a wheelchair being pushed down a hallway in Cincinnati Children's, where I had surgeries. And I was going to the gift shop, and I remember someone saying, "We're going to get Stephanie a present." I was like, awesome, I don't even know what I just did. But this is awesome. Apparently I just got out of surgery, but I didn't know that until I was an adult. So yep, same thing, stories from my parents, that's all I remember.
I remember asking if I could go to sleep before a cath, and asking if it was all right. And I guess same with Stephanie. Awesome, presents were great. Don't really remember why, but I was like, shot, ice cream, awesome. I can deal with that. So positive reinforcement, I guess, helped a lot with my learning to be in the hospital.
And that here's a question that'll go down all 6 people here. And this is, what is one resource, one something that you wish you had while you were in school? And when we get to Marshall and Natasha at the end, it'll be the same question for something they wish that more patients had access to. So you're in school, what's something that you just wish was there to make it more manageable?
I would have to say meeting another CHDer. My first person I ever met with CHD was 2 years ago. We all thought we were the only ones, so we really had no idea. Just Facebook and social media alone right now is the way we meet each other. And I wish I could have met someone a lot earlier than that, but yeah.
I'm sorry, I'm still thinking on this one. I don't really think anything. I think everything went fine. People accept me as me being me, having an IEP, 4 or 5 plan, just going through education like they would. I did my life as I could. And the only thing is I couldn't do contact sports. So it was just like, yeah, okay, I'm good with that. So I just went normal life, and that's all I accepted, and that's what I wanted. And I don't think I could have changed anything. I don't think there's anything that I wanted different. or any kind of help. Parents were supportive, family was, everything was good. That's it.
I would have changed a lot of things about my years in school. The first thing that popped into my head was I wish my teachers paid more attention to the fact that I was slow. But this is where my personal manipulation came into play. My personality is so outgoing that I was so friendly and happy and outgoing that it was like, Stephanie, what's the matter? Why aren't you, you're so outgoing, you're so happy. I heard this from people all the time. You're so this, you're so that. But your tests, you fail all of your tests. You get straight A's on homework, you get straight A's on this. Your tests, you just get F's across the board. And, what's going on? And I'd be like, oh, I'm fine, just da-da-da-da. And I would play it off and they would buy it. And as an adult, I wish that they didn't buy it because I was lying to them. I was a child and I was lying to them and they bought it. And I think all of the resources here are amazing now because I don't think this flies. I don't think the way the teachers were when I was growing up, I don't think that stuff flies anymore. And I think there is help. And another thing that a lot of CHDers in our age range, especially the older ones, we went through, there were two options. If you were slow, you had to be in classes with the severely mentally retarded kids. Or you had to suffer. Or you had to go to a tutor, and then if you had a tutor, then you were stupid and get made fun of. Now, things are so different now. Things are so, helpful, and there's so many resources for so many different things. It's not, I don't think it's taboo to have a tutor now, and I think I know there are several different classes. There's not just you suffer in all of the normal people classes, or you go to the classes with severely disabled people. I know that there are middle grounds now. And again, I could talk forever about everything, but that's all
For me, school wasn't necessarily that large of an issue until I hit college. There were classes I missed, and one of the things I really wish I knew is how to arm myself with a wonderful letter from my cardiologist, because that goes a long way. I had a cath in 2 years ago, and I was with a disability advisor. It was just kind of a, here you go, I might be in the hospital, and if I am, it's for real reasons. So I had let my disability advisor know that I was going to be having to finish things up a little bit quicker because I was going to have a cath. And I got a reply saying, well, I hope you're not lying, going to Cancun. I'm like, please, I wish I was going to Cancun. But it was heartbreaking to think I'm going through this traumatic experience right now. And I had an advisor saying, hope you're not going to Cancun. And so you really have to understand that not everyone understands. And they don't necessarily know what to say with things. Arming myself with a cardiology letter, it is fantastic. It's something recently I started doing, and it shuts everyone up pretty immediately. Because, first of all, they can use giant words that no one knows what they're talking about. And so make it sound so horrible, and they make the people feel horrible for you. And for me, especially, I'm doing biochemistry and genetics right now in school. When I first went into college, I was kind of able to get away with some stuff in high school, but college kind of became the real deal with school. And so I had to figure out a way to study that helped myself. Tutoring was one of the things, because I had no idea. Concepts weren't necessarily very easy for me to grasp. However, now learning how to study correctly, which honestly I might have been a horrible studier, I could have been it too. Might have had nothing to do with my heart. But I now know how my brain works, I guess, with processing things, and so it's so much easier to do that. And really understanding at as early of an age as possible, and this is so hard to do, is that really not everyone understands or knows what to say. I was sprinting on gymnastics, and we had to sprint a certain amount of time, and I missed it by a couple seconds. And so I had to redo sprinting, and at this time I was purple. And my dad felt like he was abusing me because he would see me like in practice purple. And my coach said, "Running has nothing to do with your heart. Keep going."
What?
Like, what? What? That would solve a lot of issues if running had nothing to do with my heart. So really, got to understand that not everyone understands.
I think the one thing I think of, and we are a homeschool family. I have no intentions of sending my children to our local public school system. But one thing I hear from a lot of families is, even with their 504 or their IEP, because their children look normal from the outside, they have, the teachers have a really hard time, and the school administration has a really hard time accepting the fact that they do indeed need all the modifications and changes that are laid out in the IEP and 504. So I wish there was more of a standardized acceptance between all the school systems, that they just understood like it's laid out. Just because they look normal doesn't mean that they're not having other problems caused by their heart defect.
I think we've sure heard a lot of pearls ranging from tutors to arming yourself with a letter from the cardiologist to limiting yourself and not letting others limit yourself for you. Let's do this. I think there's probably a lot of people in the room who want to talk to our panel, and that might be easier when we take our break, just to have some dialogue right up here. I want to give the closing words to Marshall. We'll close the panel and we'll take 20 minutes just so that people can talk and mingle before the final session. So the closing words to Cousin Marshall.
Thank you for allowing me, Jeff, to join this panel and to give some closing words. I'm going to bore you because of the two things I'm going to say. The first is going to be pure repetition. For those of you who are here, that's a very important, powerful, positive prognostic sign for your kids, because it's really the investment and the advocacy and the engagement of parents that makes this whole process successful for kids. The second thing I'd say, has to do with that crystal ball. You can't make concrete predictions, but I do want to say that I think, as represented by, these young people and by Natasha and her family, optimism is a tremendously important part of this whole process. And to put that in perspective, you're meeting some of the oldest people alive with hypoplastic left heart syndrome. There are a few in their early 30s. There are, increasingly dozens in their 20s. There isn't a ton of data based on which you can make projections. Once you get past the initial palliation, the fact about hypoplastic left heart syndrome is that it shares in common the physiology of other single ventricle anomalies. And while it took us a long time to get to where we could successfully do the Norwood operation, the initial palliation for other forms of single ventricle heart had been around for a longer time than that. And I want to let you know, my oldest Fontan patient is 57 years old. She's in the financial service industry, but she leaves work 3 times a week to go to a gymnasium, and she will not miss her exercise sessions. I think being optimistic about the future is just extremely important.
So thank you, Marshall. I'd like to thank all of our Marshall's going to have to rush out to catch a plane. We're going to take a break until 2:25, and I'm going to ask the remaining panelists to hang out up here, so if some of the parents and families